you and welcome and great to be with this very interesting panel. And then hello and good afternoon or good evening or good morning to all who have joined this interesting discussion. First of all, I may disappoint some, but I am not actually the original presenter in this panel. The original presenter was Jack Fisher. He's one of my team members, and he's actually the lead in what we're going to announce now as one of the launches mentioned by you, Pedro. But I'm head and not acting head either, but I'm head of the Secretariat of the Global Coordination Mechanism at WHO in Geneva. It's a pleasure to be with you. It's not the first time I'm supporting your initiatives. We have had a long history of active collaboration, either at Brazilian level, at regional level, or at global level with DCNTs. And this is one more of those opportunities. What we're going to present now has been also done in collaboration with participants from Brazil and from DCNTS, including Mark. So glad to see you, Mark, again. I've asked to share the slides from your end because I'm having difficulties with my internet connection. So let's see if that's possible. Thank you so much. There we are. So what I'm going to present today is actually the launch of a report. The report is Nothing for Us Without Us. Next slide, please. And while we're extremely proud of this report, I really want to send the message that actually underpinning the report is the visibilization and the prioritization of extremely critical concept and critical platform that has long been underserved and underused in the NCD narrative. And that is the meaningful engagement of people living with the diseases, meaningful engagement of people living with NCDs. I believe that for the last 30 years, this has been an underused, underserved, and misunderstood platform and concept within disease prevention, disease promotion, and policy development. And I say 30 years because I'm actually thinking about other global health agendas that have moved forward in the last 30 years extremely successfully because they have been able to understand the power, the value of lived experience, the expertise of lived experience in development, discussion, development, design, implementation, monitoring, et cetera, on policies, programs, and services. And it becomes so extremely relevant and urgent where we sit now today, where people living with NCDs have been so underserved historically, but then has been exposed, dramatically exposed, how people living with NCDs have been in a vulnerable situation for decades, exposed to the COVID pandemic. So this report, I said, marks the milestone of this a very important 3-day WHO informal consultation with people living with NCDs. It has been a long journey of trying to put together some of the pieces of the value, lessons learned from other programmatic areas, frameworks exist piecemealed here and there at global, regional, and national levels on success stories and how some of these frameworks have been working. We have put this together and brought together in a 3-day consultation from which we will look at this report with a bit of depth. But the more important thing is that also this report marks a milestone of the way forward, of how we can truly operationalize meaningful engagement, not only within WHO, but within the global agenda for NCDs. As you see there, this was a 3-day participatory meeting, and we will look into that in a bit in the following slides. So let's go to the next slide, please. So why have we identified this platform and this, as I call it, a concept? And it is because the NCD agenda, the NCD community has been lagging behind in understanding that to bridge a global development, one of the main development challenges of the 21st century, to bridge that with the attention to building back better, the attention that the SDG, the commitment that the SDG places on us all to leave no one behind. How do we bridge leaving no one behind in a situation where we are faced with one of the major global epidemics, exposed even further through the COVID? What can we do to ensure that some of the policies, programs, and services we will build back better after COVID do not leave people behind. And one of the answers to that is the appropriate attention to the expertise of lived experience in shaping those policies, programs, and services that will ensure that we do not only build back from the devastating impact of COVID, but we really build back better. And as the WHO Director General, Dr. Tedros, said very well in the opening statement of this meeting, is as we work to build back better, we must engage with civil society and individuals with lived experience to hold WHO and political leaders accountable and to drive change. WHO values your voices, your expertise, and your inputs. And Dr. Tedros is also committed to leveraging WHO's role in supporting our member states in doing the same. Highlighting, I just want to land on one word highlighting here is that the WHO through DG Tedros values the expertise. And I think that's one of the main messages coming out of our consultation, but of our long activities to try to collect the data, the evidence, and the narrative is that people living with diseases have an expertise of their own. They have multi-layered expertise, and which has to be channeled into policies, programs, and services. Next slide, please. So how was this particular consultation developed? Well, the GCM, as you may or may not know, the Global Coordination Mechanism, which I lead, is a very innovative platform within WHO. It's an engagement platform. Its particular purpose is to facilitate, catalyze, knowledge share, capacity building across the different stakeholders relevant to NCDs, certainly with WHO's resources, expertise, and knowledge, but also convening that knowledge, that expertise, and those resources from beyond WHO and within that very rich and diverse stakeholder base, and not only with civil society, but certainly across private sector, relevant private sector entities, and when and if appropriate, certainly, but also UN agencies, academia, philanthropic foundations. So we've been able to leverage that expertise and bring that relevance, and especially of people living with diseases themselves, not only NCDs, but other programmatic areas which have so much to teach us in the NCD arena. And I refer specifically to the HIV AIDS community, which they have been very vocal in insisting that a game-changing moment, a pivotal moment in their response, in the HIV response, was when they understood how, when, and through what platforms to really engage people living with HIV, and involve them in decision-making processes, a game changer. We haven't been able to identify that. HIV community identified 20, 25 years ago. We are still lagging behind in the NC community. It is time to change. And the COVID situation has placed us with an extremely fast ticking clock to be able to do this. We think that this consultation and this participatory, co-led, co-created participatory approach of this consultation will open the door to several activities that we will touch on in the coming slides. So next slide, please. So what are the objectives of the consultation going into the first day? Certainly, these are the three main. There were many other objectives of sub-objectives that we identified even going into the second and third days, but the main objectives were to explore the value of meaningful engagement and certainly building on the lessons learned from other health programs and health areas. The value of meaningful engagement, which may seem obvious to civil society in general, may seem obvious to many countries and subnational local levels who are already extremely successful in engaging communities, engaging lived experiences in policy and intervention implementation. It is not that obvious at global level, and certainly not obvious at the global NCD community. So really understanding the value of meaningful engagement and through the expertise and how we can shape frameworks to meaningfully involve those experiences in our policy design, policy development. Also, as a second objective, we also need to identify activities, work streams, platforms that are already existing, and not only within the NCD agenda, but in other programmatic areas that we can already start inserting, engaging people living with before we even think of starting new platforms. It's certainly not about reinventing the wheel. It's extremely successful platforms under UHC. engagement platforms on UHC. I said engagement platforms for developing the SDG 3 action plan, engagement platforms for HIV, for maternal and child health, where we need to think about cross-cutting policies, cross-cutting conversations, and integrated approaches that can support primary healthcare. So sort of integrating these platforms of meaningful engagement and inserting the attention to people living with NCDs in the platforms is extremely important going forward. And then the last objective was to really define next step of how we can really go ahead, next steps and operationalize that meaningful engagement with particular relevance within WHO structures, but also then how can WHO support the operationalization of meaningful engagement across other platforms, other stakeholders, and certainly at regional and national level. Next slide, please. And these were the questions that try to guiding those objectives. What does meaningful engagement really mean to the community, to those participating? How do we engage meaningfully? And where do we go from here? Underpinning sort of the three objectives. Next slide, please. And all of these are some numbers, I'll get to that, but all of these questions and all these objectives are very well unpackaged in the report. I'm just going through very briefly, inviting you obviously to read the report and look into more detail. But so going into the consultation, one of the main objectives was that this consultation should already be operationalizing meaningful involvement, and I think we hit the mark very well. You'll see that there was 37 countries represented, 54 of the participants identified as persons living with NCDs, and the gender geographical balance you can see there. That we also had 16% of participants identifying with a disability. And importantly, the stakeholder groups, certainly civil society and non-governmental organizations were included, but we did invite UN and WHO and other UN agencies, academics, independents. It's a very strong collection of experiences, if you will, and really paying attention to the intersectionality, so the different layers of lived experience, really paying attention to the policies on the ground, policies in primary healthcare, community level interventions, really need to understand the intersections of so many different layers of lived experience, not only with diseases, not only with the sole disease, not only with the sole NCD, comorbidities across the NCD agenda, comorbidities with other programmatic areas, communicable diseases, for example, and NCDs, but also intersections, healthcare, professional experience, healthcare providers, family members, gender issues, cultural issues. The intersection of layers of lived experience is so important to really hit the mark at community level on the ground and really leave no one behind. Next slide, please. So, and the emergent themes that you also see unpackaged in the report ultimately the conclusions, the emergent themes in a sense, are that meaningful engagement actually activates agents of change. And those agents of change will populate our policy design, our policy implementation, our advocacy efforts, our communications efforts, and our political discussions. So how can we ensure capacity for those agents of change? What is needed? Resources, financing, structures, formats, workshops, at what level? Global, regional, national, subnational? How can we ensure sustainable capacity building of agents of change? Also, a main theme was from talking the talk to walking the talk. I am actually talking the talk. I should be more walking the talk. At this moment, we are, as from my office now, after the report, we're going to start walking the talk by implementing some of these actions that were identified in the report, and we invite all of this community to join us. And the last part was what are exactly those actions we want to see? Next slide, please. And these are the next slides. I don't have many more slides. These are one of the few, the last ones. But our next steps that we invite all of you to join us, and we have structured particular activities and interventions are those following. The top row really is that really was identified in the consultation and beyond, is that there's a huge lack of data, evidence, best practices, case studies on what really is happening in the NCD agenda and what is the impact of meaningful engagement in those areas where it has been successful. So we will start mapping best practices and case studies. We will explore alignment, integration with other lived experience communities, also conduct extensive stakeholder mapping on that intersectionality and what do we have to think about when understanding the representation we want at the table. Is it across diseases, across geographical, contextual specificities. How can we start mapping the necessary stakeholders we need on the table? The other is to conduct additional focused contextual consultations like the one we had, but certainly reaching more and more towards the community level. Can we have those consultations at regional, at national, subnational, community level with your support? And then the last, the line at the bottom is, then when we have that data, how can we go forward? We need to renew advocacy support for those agents of change, the capacity building for those agents of change by identifying funding models, for example, and models, frameworks for the sustainable and formal inclusion of people living with these structures. And from then co-create an action plan with people living with disease and what we're calling a WHO framework of engagement with people living with NCDs. Next slide, please. Please let me know timing. I tend to be very passionate about this and talk a lot, but you
2
just cut
minutes.
me off.
Yeah.
All right. So this is a busy slide. I won't go through all of it, but it really is that the conclusions. The conclusion is, I've mentioned some of them across my slides. Conclusion is that lived experience is an expertise in itself, and that is not truly understood in the NCD agenda. We need to move from tokenistic participation to real decision-making processes through the expertise of those lived experiences, formal, sustained participation, and not just tokenistic. And that really is by meaningful, respectful, and inclusive involvement across the value chain of policy design, development, implementation, monitoring, and accountability, which is so important. And then the ultimate thing is that maybe I'll summarize that all of this information and all of these activities and next steps, which we'll be developing into 2021 and in the beginning of 2022, it will end up hopefully with a very impactful and clear and precise WHO framework for meaningful engagement of people living with NCDs, which will serve as a basis for operationalizing meaningful engagement at regional level and certainly, we hope, more importantly, at national and subnational level. So we will be contacting you for sure during this process, during the main activities to accompany in this journey to really prioritize and have that game-changing moment, that pivotal moment that the HIV community shares with us all the time. This is a pivotal moment when we can shape policies, shape programs for inclusive attention to people living with NCDs. Thank you so much.